So very good morning. So this PPT, it's a short PPT, but it's full of information. So my topic is nervous sanitation. It's not a technical issue. This is a common problem of students. There is a low maintenance of the field. So let us start from introduction to nervous sanitation. So that refers to complete physical, mental, and overall social well-being. It does not
Existing solution को बोलते हैं तो existing solution result की finding
how it becomes, it is also a part of this sanitation. Sanitation means maintaining cleanliness and proper disposal of waste. Cleanliness is very important in our day-to-day life as well as disposal of waste. There is everywhere, if there is garbage, then of course it will affect the environment and it will lead to disease. Both are essential for safe and healthy life. They play a key role in social and national development. Of course, our government is playing various role on this topic. We will see about it in our further slides. So, second slide is about what is poor hygiene. Poor hygiene is refers to the unhealthy practices and living conditions that fails to maintain cleanliness, resulting in the spread of disease. We can see that people are just throwing garbage everywhere, and due to this, there is lack of cleanliness in our environment, in our society, and which leads to spread of disease. Unsafe drinking water is one of the major causes of poor hygiene. Of course, in many of the rural areas, we can see that people are drinking contaminated water, and which is not very, we can see the reason for drinking. And consuming contaminated water contains bacteria, viruses, or chemical waste to serious health diseases such as cholera, typhoid, and diarrhea. Open defecation is another serious hygiene problem. Mainly rural and undeveloped areas. It contaminates the soil and water resources, increases the spread of infection and creates unhealthy environment for the community. This problem is mainly in rural areas. Now, for this government has also taken some initiatives to implement many of these things, which is now reduces these problems. Improper waste disposal includes throwing garbage in the open areas, streets, and water bodies, leads to bad odor, breeding of mosquitoes and flies, and spread of disease like malaria and TB. Of course, as we see, due to the waste from everywhere, the mosquitoes are breeding on it, and due to that breeding, there is increase in mosquito population, and we felt it, and due to this, malaria and TB is such a dangerous disease cause. Effects of poor hygiene. Of course, where there is something cause, there is effects. So the cause is the cause spread of an infectious disease, leads to malnutrition and many children. Due to this, when the child is born, due to this poor hygienic situation, due to lack of sanitation, there is a situation like malnutrition. We can see this picture. This man is not perfectly filled. He is not perfectly grown. His muscles are weak. He is unhealthy. Increased medical and treatment expenses. Of course, due to high expenses, a poor person can't afford medical expenses. Reduces work efficiency and productivity. Of course, if our health is not good, then how we can do a productive work? Common diseases due to poor sanitation. These are a few of the diseases which can be spread due to poor hygiene and all. Our government initiatives. The Swachh Bharat Abhiyan, which was launched by our Honorable Prime Minister Narendra Modi, launched to improve cleanliness and sanitation, construction of household and public toilets, then after Ayushman Bharat Yojana, this is a very useful yojana for poor people who are not able to pay the expenses of hospitals for their response. This is like golden opportunity. They are able to treat themselves with the benefit of 5 lakhs, which is being paid by government. Then after National Health Mission, Sanitation provides public health facilities in rural and urban areas, focus on mother, children and newborns. Of course, this is one of the best things because we focus on the young, we focus on the child because they are the future of our country. Now, this National Mission, this initiative was totally based on the contaminated water problem. So it provides different drinking water to the household, reduces water bodies, into sanitation and hygiene standards. Problem faced by the people. course, there was a problem many years ago. Like this was we had seen this is the Manjari mountain line. This is between a biographical movie which was of a biography of Mr. Manjari. This movie tells us that how he was unable to take his wife to the nearest hospital, and due to that transportation issues he lost his wife as well. Due to there was many issues, the transportation issues, there was the financial condition, then there was the health issues. He had cut down the mountain just to make the transport easy, just to make the long distance hospitals and health centers nearer to the residents. High cost of medical treatment, delaying disease diagnosis and care, and poor quality of healthcare services are the main problems which are faced by the people. Now, the impact on society. Usually, these are the impacts, such as increase in death rate, especially among the children and elderly. Okay, elderly is okay, but it was especially among the children, and which was not crucial for our development. Then, low life expectancy due to frequent illness. If there is frequent illness, how this continuous carry out. Then economic loss due to high healthcare expenses reduces workforce efficiency and productivity. Poor human development and quality of life, increased burden on the healthcare system. If there is no healthcare, if there is no proper sanitation, then of course quality of life is not that good. So conclusion is there should be hygiene education, there should be good hygiene practices, people should be aware about their hygiene, proper sanitation, menstrual hygiene is the main problem. Responsibility should be taken for by everyone that they should keep themselves to be clean. And after this is the main conclusion of my pretty overall conclusion, that is personal hygiene is needed. If once takes the personal hygiene, then there is no need for overall hygiene.